talk about today what radiofrequency ablations are. Do they work to relieve the pain for a long time? Are there any side effects? So you can make an informed decisions, okay? Usually the nerve ablation is done for the spinal nerve for a neck pain or a back pain. So in the spinal nerve, there is a costochondral nerve that has two branches when it comes out of the spinal cord, and it supplies the median nerve and the lateral branches. The median branch supplies the facet joint, and it's usually the culprit of your pain on the spine. So what they do, they give you some kind of a numbing injections on this branch of the costochondral nerve, and if pain dissipates, that means they found the right nerve. Okay, now there are two types of radiofrequency nerve ablations out there. The first one is called continuous radiofrequency ablations, and what they do is they use the electrical current is applied, gradually increase to the temperature between 50 degrees to 80 degrees, that's about 122 to 176 Fahrenheit, and this temperature stays stable for about 80 to 90 seconds, and this is approximately length of the time is required to heat to cause the nerve damage. Okay, so pretty much you're causing a nerve damage. This pulse is applied to multiple nerve sites to increase the likelihood of the pain relief. Okay, now the second kind is called pulse radiofrequency ablations, which uses the different levels of electrical current at different intervals held for varying length of time. The brief interval of the high voltage current is about 20 milliseconds, are followed by longer intervals which are about 489 milliseconds. Now the temperature produced in this intervals ranges from 40 degrees to 42 degrees centigrade, or 104 to 107 degrees Fahrenheit. So this pattern is repeats for at least 2 minutes up to 8 minutes depending on the location and the number of the nerves they're working on. Okay, let's talk about the side effects. Number one is the temporary numbness or a burning. Most of the time after the around the areas there will be some numbness from the injected corticosteroids or analgesics. When they wear off, you're going to start feeling this and tingling in that area, which usually wears off within 2 weeks or less. Second thing is the temporary pain at the procedure sites. Again, once the analgesic wears off, you're going to feel some kind of a minor discomfort. The infection is whenever your skin is punctured, infection is possible even though it's rare. Next is bleeding. Bleeding after any procedures are usually rare, but it's possible. Whenever the skin is punctured, the bleeding can occur. In some rare cases, the bleeding can occur inside the body, and it's sometimes creates a thrombus, and it needs further treatment. Number 5 is a nerve damage. Nerve damage on those non-targeted nerve can occur as a result of improper placements of the electrodes. They do use the fluoroscopy or X-rays to ensure the proper placements to reduce the risk for radiofrequency ablation complications, but this can happen. Okay. The motor deficits, again, the nerve damage that occurs during the procedures, the purpose is to decrease the pain sensation and not affect the motor skills, but that can happen. You might lose strength or control, and you might need a physical therapy after that. The number 7 is paralysis. It can really cut and really damage the nerve so much that can create the paralysis, and it's again from the improper placements of the electrodes. Okay, so make sure wherever you go to get this procedure done that you're going through an expert who have done thousands of these procedures already. Number 8 is a muscle weakness. Muscle weakness is related to either improper placements of needles or electrodes or an incorrect use of electrical current. Most muscle weaknesses will correct itself over time as the nerves regrow, but in some cases you might need to go for physical therapy. Severe pain, number 9. Radiofrequency, this is again rare, but it does happens again if they have created a lot of nerve damage in that area and inadequate sedations. Number 10 is allergic reactions. So how long does the pain relief last? Before we go any further, have you had a nerve ablation done, and how long was your pain relief? Because pain is so personal, reports of a pain relief timeline ranges from beginning immediately. separate from some side effects, the beginning side effects, versus lasting for months, few months, or take several weeks and offer only mild pain relief. So in some cases, patients experience profound and lasting pain relief, while the others have some residual pain that doesn't respond to this procedure at all. And they say that if no pain relief occurs, the proper nerves may not be targeted and the procedure may need to be repeated in 2 to 3 weeks. So in most people, nerve damage by radiofrequency ablations may regrow between 6 to 18 months, okay? So here is in summary, radiofrequency nerve ablations damages the nerve with the high heat for a pain relief, which can give you anywhere from 3 months to 12 months of pain relief. Not 100% cure, remember that. It takes the pain down by few notches. Usually 7 out of 10 people have some kind of a pain relief. 1 out of 10 people have a longer pain relief, only 10% of the people. The problem is that the nerves do grow back, and when nerves grow back, they sprout. So when those ends meet, they create severe shock from those scar tissues. Not only that, this procedure burns the myelin sheath, which is the fat layer around the nerve. Have you seen an electric wire with the plastic coating around it? Red, blue, green. You know what I'm talking about. What happens if that plastic coating is broken and electricity runs through them? It shocks you, right? Same for the nerves. When those myelin sheaths are off, it comes as a shocking sight. That's where those shock comes from. So now you have all the information, so you can make the informed decisions on whether you should go for a nerve ablation procedures or not. With my experience, with several of my clients who have gone through these procedures, I will give my honest opinion. Again, it's my opinion. There might be one who may have some pain relief, not the 100% pain relief, maximum for 12 months. Now, this procedure is not cheap. You pay money to damage your nerves so you can have a short-term pain relief. You're risking that thing can go wrong. Pain can come back stronger than before. So why not try something that is risk-free, no side effects, proven by science, that gives you lasting pain relief? Yes, it involves some work, patience, commitment, and some guidance, but it will be so much worth in a long run.